My name is Jennifer A. McPherson. I am a licensed professional counselor in the states of Pennsylvania, Delaware, and Florida. I am also the owner and clinical director of McPherson Clinical and Consulting Services. McPherson Clinical and Consulting Services is a BIPOC-focused and LGBTQIA plus friendly mental health practice that has hybrid services specifically meant for those two populations. And we specifically target those populations because we understand the need that these two populations really have when it comes to mental health. One, we know that only 4% of clinicians in our field are categorized as BIPOC. So there's not enough of us to go around for the people that we are looking to serve. And mental health does affect our communities as well, too.
My name is Elzetter Norris. I am a therapist working in Pembroke, North Carolina. I work with ages 18 months and up. My specialties are I'd say my specialties are play therapy, TFCBT, addiction. Where I work is where I'm born and raised, and I am a Native American. And it's a passion of mine to be able to bring help to my area. There's a lot of struggles in our area with addiction, violence, and there's a lot of stigma and seeking help.
Generally, mental health is already stigmatized, but in BIPOC communities, it's even more stigmatized. So oftentimes we have to meet clients where they are, give them education that mental health is part of just their overall health, building trust in systems and letting them know that they can be taken care of and regarded. Letting them know that it's okay to not be okay and that we're all having human experiences as well too, and to help people with those human experiences, whether it be anxiety, depression, trauma, adjustment disorder, any type of transitions and things like that, and really normalize taking care of yourself in a way that hasn't really been popular in the past history as well too. I am of Caribbean descent. My family is from the West Indies and the Lower Antilles. So oftentimes when I might meet with a client that might have a similar background as mine, I might understand that their culture might be different compared to someone that might still be part of the Black diaspora, but there's nuances from being in the Caribbean. So being able to understand things such as attachment and upbringing and all of those beautiful things that go into making someone who they are and part of their cultural background, and integrating how we see them as a person and conceptualizing them and seeing how it can get them from point A to point B can really be part of the cultural awareness aspect that we use in therapy. And using someone's culture towards healing really lets them be seen like, hey, I'm not just a client or just a number and you're just doing this thing with me in session. You're really seeing all parts of me and taking that in consideration. And I feel like all parts of me can heal as well too. So that's why it's such a beautiful thing when we integrate someone's culture and background into the treatment process.
I would say for anyone that working with a population that they are not familiar with, to immerse themselves with that population and really get to know them. It really makes a difference as a helper when you really understand the culture, and you don't want to be that expert in the room, you want to be that helper in the room.